Hey everybody, it's Dr. Heath Lampee here today with Beyond Dentistry. Today I want to talk about why I created Beyond Dentistry and why I think it's even more important in today's environment. I graduated over 12 years ago from dental school at OHSU here in Oregon, and I had a big desire when I was done, I was only 25 then by the way, to do bigger types of dentistry. Dental school just left me with the ability to do simple fillings, simple crowns, simple extractions, simple root canals. That's what I paid my $200,000 for. When I left school, I started a practice from nothing, totally from scratch, almost no patients, very insurance driven, and I knew I wanted to do something bigger. So I started seeking out continuing education. And I still remember the first time I took a class. I signed up. It was about a year after I graduated. I wanted to learn a little bit about sedation because it seemed interesting. I took the class. It was a $3,000 or $4,000 investment. I had to travel. I had to take a few days off of work. It seemed like a lot of money at the time, and I wasn't sure, was it going to be worth it? And what I found in hindsight is if I hadn't have done that first class, I wouldn't have continued on the path in dentistry that I am at today. That was a foundation of me realizing how important the education after dental school is. From there on, I actually became addicted to going to continuing education. I would go 2 or 3 weekends a month. This was before I was married, before kids. I would go all over the country just learning, from Los Angeles to Dallas to San Francisco, from all sorts of places. And eventually I realized I was addicted to continuing education. I would talk to people at each course and they would say, maybe you should go see this or see that, and I want to learn this, so you need to go over here. And it took me a long time to figure out all the pieces of the dental continuing education puzzle. There was no company out there that actually was able to teach restorative, surgery, practice management, debt management, team management. There was no corporation out there that taught this. So I'm going to all these different courses for years and years and years. I even took some of the classes 3 or 4 times because I realized every time I repeated the course, I was a different dentist. I had tried something, I had failed, I had succeeded, I wanted to try things a little bit different. I wanted to talk to the presenter about it. So I'm slowly putting all the pieces of the puzzle together in my own practice from the things that I had learned at the CE courses. And I'm realizing now, after 12 years, that I need to start teaching students that there is a better way of learning. And Beyond Dentistry is going to include the restorative procedures, surgical procedures, and all the practice and debt management that we need today. Now, I am 37 years old. This is 2019. And I've been doing it over 12 years, and I'm doing this just like you. My struggles are your struggles. I didn't do this in the 1980s or 1990s. I'm doing it today in a hyper-competitive market. There are probably a dozen dentists down the street from me, even more probably. They all take insurance. They take every kind of insurance. Now I have decided to practice completely different. So that is the difference here, is that you can work less. You can do fewer procedures that you can actually get better at, focus in on, hone in on, and that's what Beyond Dentistry is going to teach. We start with the fundamentals of complex restorations and implant surgery from 1 implant to 8 implants or more. We start with that and we keep on building so that whether you choose to do both the surgery or the restorative, if you want to do both, great, we can teach you that. If you want to do one or the other, we can show you how to talk to the other surgeon or restorative dentist about what you need to get done and how to do it perfectly. So the other thing is I'm going to teach you how to treatment plan and diagnose cases from a whole new light. I have a big philosophy that I don't think about just today or just a single tooth. I think 10 or 20 or 30 years down the road, from a full health and a full body and mouth evaluation of the patient. I'm going to have you ask the patient, do you want to keep your teeth or not? You'll be surprised, a lot of patients that need complex work don't want to keep their teeth. They are frustrated and tired of their teeth and all the dentistry they've had. So if they don't want to keep their teeth, those teeth have to go, and you're going to find a new large complex implant restoration to replace those. Beyond Dentistry is going to teach you 90% of what you need to know to be an amazingly successful dentist in today's environment. one thing that I'm very honest with my students about, I can teach you 90%, but there's 10% where I'm not an expert at. And I have a very open and transparent policy where if I can't teach you how to do it perfectly, I'm going to tell you who to go see to learn it. I'm going to say, you need to go see this guy in Seattle. You need to go see this guy in Dallas, Texas, because I want you to practice at the top of your game. If you're going to be successful in today's environment, you have to be different from everybody else. So that's why I created Beyond Dentistry, to give dentists a new power in this very, very competitive world so they can do things differently. They can do amazing cases. They can diagnose them. They can treat them if they choose, or they can work with a surgeon or a restorative dentist to help finish the case. And they can also change and transform their patients' lives, their smiles, their health. Beyond Dentistry Education is the best education for dentists of all ages, of all practice types, from all areas of the country and of the world. This is the new way of looking at dentistry. It's the new way of being the most successful dentist that you can, clinically, in business, and in life. We'll see you soon. Thank you so much.